All right, let's jump right in. In this explainer, we're unpacking a really crucial new study from the World Health Organization and the UN's Human Reproduction Program. We're tackling a deeply sensitive but universally important topic today, the lifelong health impacts of female genital mutilation, or FGM. It's an issue layered with cultural complexity, but today we're focusing squarely on the hard clinical data. By the end of our time together, you're going to have a very clear, evidence-based understanding of exactly how this practice impacts the human body and mind over an entire lifetime. To really wrap our heads around the global scale of this issue, we've got to start with just a staggering number. We're talking about an estimated 230 million women and girls alive today who have undergone FGM. Let that sink in for a second. 230 million. That's a massive demographic spread out across roughly 30 countries, mostly in Africa and Asia. So this isn't some isolated or rare occurrence. It's a daily reality for literally hundreds of millions of people right now. Now, you might be thinking, isn't this practice declining? And well, yes, the overall proportion of people experiencing FGM is going down globally. But because youth populations are growing so incredibly fast in the areas where it's practiced, the absolute number of cases could actually increase. So we really have to ask the big question driving our explainer today. What exactly does the latest clinical evidence tell us about the long-term, daily reality for these survivors? What's the true physical and mental toll over decades? Just to make sure we're all on the exact same page, before we dig into the health outcomes, let's define what we're talking about. The WHO officially defines FGM as the partial or total removal of the external female genitalia, or any other injury to those organs, like cutting or burning, for completely non-medical reasons. It is universally recognized as an extreme form of gender discrimination and a very clear, undeniable violation of human rights. And that is exactly why this newly published research in BMC Public Health is such a game changer. Look, this isn't just one localized, small-scale survey. No way. The researchers did a massive deep dive, analyzing robust evidence from more than 75 different studies across about 30 countries. By pulling together all this data, comparing women with and without FGM, they've given us a devastatingly clear picture of how these injuries impact a survivor at literally every single stage of her life. So let's look at the specific on-the-ground reality, starting with the immediate aftermath of the procedure. We're talking about severe, life-threatening physical trauma right out of the gate. Think massive infections, heavy blood loss, and extreme acute pain, which is immediately compounded by deep emotional trauma. The danger is absolutely immediate, often happening in non-sterile environments, putting young girls in instant, life-threatening jeopardy. If we map this out chronologically, the WHO's core finding is pretty unmistakable. Sometimes people think of FGM as a brief event that eventually heals. Actually, scratch that. It's the exact opposite. It's a chronic condition. While childhood brings those acute injuries we just mentioned, hitting puberty often kicks off chronic menstrual difficulties. And then, moving into adulthood, survivors frequently face severe urological complications. We're talking chronic UTIs, severe difficulty urinating, and intensely painful intercourse. The initial trauma just keeps echoing through every biological milestone. But the toll isn't just physical, right? The research shines a huge spotlight on the invisible scars, how deeply FGM impacts the mind. When you compare survivors to women without FGM, the risk for depression and anxiety triples. It's a 3 times greater risk. And even more startling, there is a 4.4 times higher likelihood of dealing with post-traumatic stress disorder. The psychological damage is profound, it's highly measurable, and it very often lasts a lifetime. Fast forward to when these survivors transitioned into motherhood, and the health system sees this huge, alarming spike in complications. The clinical data leaves absolutely no room for doubt here. When women with FGM go into childbirth, they face more than double the risk of enduring a prolonged or obstructed labor. They're also at a greater than 2-fold risk for severe hemorrhage. Because of all this, they're significantly more likely to need emergency interventions, like C-sections or forceps, just to survive the delivery. And tragically, the danger doesn't stop with the mother. It directly threatens the baby too. The WHO's study shows that newborns of women who have undergone FGM are way more likely to suffer critical birth complications. We see much higher rates of fetal distress and asphyxia, meaning the baby isn't getting enough oxygen during birth. This cascades directly into lower newborn survival rates. It's devastating to realize that the harm of this practice literally jeopardizes the very survival of the next generation. Okay, now I really want to highlight a modern trend the data uncovered because it is incredibly alarming. It's what they call the medicalization of FGM. There's this dangerous myth out there that having a trained health worker do the procedure makes it safer. But the hard reality, firmly backed by the data, is that health workers actually often perform deeper, more severe cuts. So medicalizing FGM can literally result in far worse, deeply devastating long-term damage. Having a doctor do it doesn't validate the practice. It often makes the physiological outcomes much worse. Sometimes you really have to step back from the raw statistics and look at the human imperative here. Dr. Pascal Alati, who directs sexual and reproductive health and research at the WHO, summed up these findings so powerfully. She said, "This study paints a devastating picture of the manifold health implications spanning mental and physical health and undermining emotional well-being." It's a stark reminder, right? Behind every single one of these data points is a woman or girl navigating a profoundly altered life. So, armed with this totally unequivocal medical data, what's the game plan? How do we move forward? Well, the WHO lays out a pretty holistic strategy. First up, health systems have got to provide timely, high-quality, specialized care for survivors to help manage these complex, lifelong symptoms. Second, we need to actively engage health workers, not to do the procedure, obviously, but to educate families and communities about these exact medical harms. And third, we need serious, unwavering political commitment to stop the practice entirely, hand in hand with empowering women and girls. Which brings us to the ultimate question we want to leave you with today. We've gone through the undeniable evidence of the lifelong physical and mental toll. We know the massive risks to mothers and their babies. So how can local communities, who are often driven by very deep cultural norms, and the global health sector genuinely team up to break this cycle once and for all? How do we leverage this clinical data to protect the next generation of 230 million women and girls? It is a massive challenge, no doubt about it. But as this data makes crystal clear, it's a conversation we literally cannot afford to ignore.